My name is Annie O'Shea. I'm a general surgery resident from Brooke Army Medical Center, and today I'm presenting in place of my colleague, Dr. Kemp Bohan, who can't be here this morning. But we're going to be discussing a novel biofilm disrupting antimicrobial wound cleanser that improves wound healing. This is just a standard disclaimer that these are the views of the authors and don't reflect the views of the DoD, and the DoD does not necessarily endorse the manufacturer. This is our necessary disclosure slide. Most of us don't have any conflicts of interest. However, a couple of the authors do endorse Rochelle Industries, and then these are our funding sources for the study. So a little bit of background. Wound contamination and infection are significant impediments to wound healing. Burn injuries and traumatic injuries are dirty wounds by definition, and then also chronic wounds frequently become colonized. Bacterial wounds resist host defenses and antimicrobial agents by forming biofilms. This is a combination of the bacteria themselves and then extracellular polymers. These biofilms typically are difficult to treat and require multimodal therapy with different antibiotics and topical wound cleansers. Treatment success is really directly related to wound healing, with failure to heal being tied to the presence of a biofilm and the bacterial load within that wound. The wound cleanser in this study is called Biocose. It contains multiple agents that independently target various elements of biofilms and bacteria. Polyhexamethylene biguanide, or PHMB, is a broad-spectrum cationic antimicrobial that interacts with anions in the microbial membrane to disrupt bacterial cell membranes, but can also enter the bacterial cells and disrupt cell replication and division. EDTA acts as a chelating agent and binds metal cations and disrupts the bacterial cell membranes. And then vicinodiols also disrupt microbial membranes, particularly among gram-positives and yeast, but also provide hydration and lubrication to the wound. Thus, all components of these have some inherent antimicrobial activity, but each acts with a slightly different mechanism. In a recently published study evaluating individual components of Biocose, as well as the combined formula in an in vitro treatment of Pseudomonas in staph, found that in combination, the individual components do not simply appear to be additive, but in fact, they are synergistic. In an in vivo model, McMahon et al. Examined microbial regrowth after 72 hours of a 10-minute application of various wound cleansers in a bacterial biofilm. They looked at Pseudomonas, MRSA, and Candida, each washed with Biocose, which is PHMB1 on that side in the orange. Protozoan, PHMB2 is another product containing PHMB. HOCl1, or microcin, is a hypochlorous acid derivative, and examining all of these, Biocose performing comparably to hydrochlorous acid in the light blue there. Furthermore, in an ex vivo model, treatment with daily treatment with Biocose resulted in substantially lower Candida bioburden related to other wound cleansers. In the same model, looking at Pseudomonas, daily treatment with Biocose reduced the Pseudomonas bioburden, though the wound cleanser that reduced the bioburden the most was actually NaOCl2, which is Dakins. With this background information of the in vitro and ex vivo success, we wanted to evaluate the effectiveness of Biocose relative to an accepted wound cleanser, in this case Vosh, in facilitating wound healing in an outpatient and clinical setting. To do this, we retrospectively reviewed the charts of 30 patients who presented to our wound care clinic with wounds in various stages of healing. We selected for review 15 continuous patients who underwent treatment with Biocose and 15 who underwent treatment with Vosh over a similar time period. Treatment consisted of a 10-minute wash with either Biocose or Vosh. Patients were treated with the same product in consecutive visits, and repeat visits typically occurred at weekly or biweekly intervals. We collected demographic data, medical history data related to conditions that may impact wound healing, and wound data. Wounds were each measured with an assessment tool, wounds were measured at each visit with the Bates-Jensen scores, which is a wound assessment tool designed to be an objective means of scoring wounds by tracking healing, and contains items such as wound size, depth, edges, undermining, looking for presence of necrotic tissue, presence of granulation tissue or epithelialization, amount and character of any exudate, and then surrounding skin tissue and character, with higher scores indicative of more severe wounds. And then finally, we also performed molecular imaging pre and post-treatment at each visit, and then the fluorescence on these images were compared using ImageJ software. Patients in our BioCOS treatment group were more frequently female, more frequently had diabetes as a comorbid condition. Additionally, patients in the BioCOS group tended to undergo treatment for a shorter period of time, although this did not reach statistical significance. The primary outcomes of this study were to assess for a decrease in wound size and a decrease in the Bates-Jensen score. While the median reduction in wound size during the study was higher in the BioCOS group, and in fact was nearly double the reduction seen in the Bosch group, this did not reach statistical significance, given a vast range of wound size changes seen in the Bosch group. However, the Bates-Jensen score improved to a greater degree than the BioCOS group than in the Bosch group, and this difference, in fact, was statistically significant. The next few slides display some of the molecular image analysis taken from this study. The first slide is of a patient treated with BioCOS. The pre-wash gross image is shown on the left there, and the pre-wash molecular image is shown in the middle, and the post-wash molecular image is on the right. While the image analysis is a little bit more complicated, in general, the red fluorescence indicates signs of infection in biofilm. Specifically, it's looking at greater than 10 to the 4th colony-forming units per gram of tissue. And you can subjectively see that there's a reduction in this from pre to post-wash. This change can actually be quantified and can be used to compare wounds over time. Here we compare the pre-wash image at the patient's first visit to the pre-wash image taken at the patient's last visit. Those are the two middle pictures there. And you can actually see that there was approximately a 40% reduction in the fluorescence seen. This is compared to a patient treated with Bosch. Again, pre-wash images were compared in the middle pictures there. And you can see there was a mean reduction in fluorescence of about 20%, comparing the patient's first and last visits. There are a number of obvious limitations to our study. First of all, it's retrospective. There was no patient randomization, and the study only reports the results of 15 patients in each arm. This did hinder our statistical analysis, as demonstrated by the wide variety of outcome values. In addition, the image capture was not standardized, and thus image quality and analysis was not as objective as it could have been. Finally, there were a number of variables in the patients and wounds treated that, secondary to a lack of power, are not really controlled for in this study. There were no requirements for wound size or stage, nor were any patients excluded or included based on time from injury or wound development to wound treatment. And there was no protocol-driven treatment schedule, although frequent treatments were certainly recommended. However, despite these limitations, the study did demonstrate that BioCOS is at least a viable alternative to current wound cleanser products. It appears to subjectively reduce wound biofilm burden and improves the overall character of wounds, facilitating the healing process. Data taken from in vitro, in vivo, and now first in human studies all support further investigation of this product, though convincing randomized data is still lacking. A randomized study with appropriate power to address the numerous variables associated with these wounds is certainly needed, and we hope to be a part of that in the future. Thank you for your time. I'll take any questions.